During Heart Month, Local 4 is looking at various factors that can have a negative impact on your heart health.
Researchers say there's growing evidence that COVID-19 is one of those factors, particularly for younger adults.
It's a trend causing concern across the country. A national study by Cedars-Sinai Hospital shows deaths related to heart attacks increased across every age group since the spring of 2020. But the group that saw the biggest increase was young adults.
Young people are obviously not really supposed to die of heart attack.
The relative increase in heart attack-associated deaths among 25 to 44-year-olds was 30%, far more than the increase in middle and older age groups, which ranged between 15 and 20%. So why the spike in heart problems with each pandemic wave? Dr. Susan Chang, a co-author of the study, is concerned about the COVID connection.
There are a lot of things that COVID can do to the cardiovascular system. It appears to be able to increase the likelihood of blood clot formation. It seems to stir up inflammation in the blood vessels. It seems to also cause, in some people, an overwhelming stress that can also cause a spike in blood pressure.
Researchers are still working to figure out why younger people would be more impacted. Studies show COVID-19 is also linked to a rare condition called myocarditis, the inflammation of the heart muscle itself. While the mRNA vaccines have been linked to rare cases of myocarditis, health experts say it's clear being infected with the virus itself is much more dangerous to the heart.
The risk of heart injury, of myocarditis or pericarditis from the vaccine is so much lower than the risk from the COVID itself.
Researchers only beginning to chart the long-term impacts the pandemic has on the heart.
And it's not clear how long the risk of heart attack remains elevated after a COVID infection. The long-term impacts remain an area of interest and concern among researchers.